Hi, my name is Emmeline Kelly. This project is about integration of evidence-based practice and research into the existing LPN2RN diploma program. The significant change in the health and healthcare needs had prompted a call for health transformation. This health reform demands that in order to provide a high quality of care, nurses are expected to practice using the best available evidence from research as a guide in decision making in clinical practice. Evidence-based is certainly not a new concept. It is promoted as a way to improve nursing practice and patient outcomes. A number of articles suggest that nursing practice guided by evidence from research helps ensure growth in nursing practice, improve clinical outcomes, and contributes to cost effectiveness in the delivery of patient care. Although it has been well substantiated, several issues surrounding the implementation and use of evidence-based research continues. Many studies have identified multiple barriers that affected the advancement of evidence-based practice. The three highest ranked barriers were lack of knowledge and competence in reviewing and evaluating research articles, lack of time in finding and reviewing research articles, and a lack of confidence and skills in implementing evidence-based practice. Other barriers identified also include the lack of support from the organization and lack of access to research. Knowledge, skills, and attitude related to evidence-based practice and research are expected from all nursing graduates. The science of nursing, as described by the American Nurses Association, is based on critical thinking framework that serves as a foundation of clinical decision-making and evidence-based practice. According to ANA, the use of EBP to guide nursing practice could result in the delivery of safe, effective, and efficient quality health care. To achieve the best outcomes for individuals, groups, populations, and healthcare system, nurses are expected to guide practice decisions using the best available scientific evidence from research in conjunction with the data generated from practice and the consumer's values preferences. Therefore, to conform to the nursing standards in delivering high-quality nursing care, all nursing graduates, regardless of preparation, are expected to have the knowledge related to evidence-based practice, research literature review, and application of findings to assist in provision of nursing care. The evidence-based and research education is certainly limited in the diploma RN programs. The endeavor for integration of EBP and research into a diploma curriculum arose from my current practice. Despite of its importance, evidence-based practice and research are addressed at a superficial level. The vast amount of information that are required to be included in a nursing program allows very little room for evidence-based practice and research education, making inclusion not a priority. In today's healthcare, it is critical that all nursing graduates, regardless of preparation, have the knowledge and skills that would empower them to use evidence from research to guide their nursing practice to improve patient outcomes. Education and scientific knowledge are associated. A number of studies have concluded that there is a strong association between education and scientific knowledge. One study found that nurses who had EBP and research education found fewer barriers to EBP and research use. In another study, it was reported that the nurses who believed they were knowledgeable about evidence-based were more likely to teach evidence-based to others, making incorporation of EBP competencies an important element of nursing education. Multiple research studies support that nurses who received knowledge and skills in research methods and evidence-based practice from their pre-licensure nursing education program are more likely to incorporate evidence-based decision-making into their clinical practice. Therefore, to address the identified gap, the proposed project is to integrate education in evidence-based practice and research methods in the current LPN to RN diploma nursing curriculum. The purpose of this integration is to provide the nursing students the opportunity for introduction to scientific research process, critical thinking process, and develop the information literacy skills that will enable them to find evidence that can assist them in clinical decision and practice. It has been well established in the literature that the gap between theory, practice, and education remains. Also, barriers that affected the advancement of evidence-based practice and research have been identified in multiple studies. Those barriers are lack of knowledge and skills, lack of time, lack of confidence, lack of access, and lack of organizational support. Also, a number of studies have concluded that there is a strong association between education and scientific knowledge that affects the evidence-based practice and research use. In the study of nurses in Iran, it was reported that successful implementation of evidence-based practice was influenced by previous training and education received by the nurses. This supports similar findings from Oman. Nurses who received education in evidence-based practice and research reported fewer barriers to finding and reviewing research than those nurses who did not receive academic preparation. Several studies also reported that nurses who had education in research methods and evidence-based practice had more positive attitudes and more likely to use research and implement EBP to improve provision of care. In another study suggests that nurses who receive support from organization by providing training and education in research and evidence-based practice implementation are more likely to use research findings, which results in increased implementation of evidence-based practice. In planning the development and implementation of the project, a theoretical framework called logic model was chosen. Kellogg refers to the program elements as inputs, activities, outputs, and outcomes. The organization's resources and raw materials, which include the client or consumers, staff, material resources, facilities, and equipment are considered as inputs. Activities are the specific procedures that will be implemented in order to carry out the program. Kellogg defines activities as the process, tools, events, technology, and actions, which brings about the intended changes of the program. Outputs are the product of result of the program activities. It includes types, levels, and targets of service. Outcomes relates to the specific changes brought about by program implementation. The use of this model has the element of being able to provide a visualization of incremental changes by allowing schematic overview of the program. This is the drafted program logic model for integration of evidence-based practice and research into the LPN to RN diploma program. It includes the goals, the inputs, the activities that has to happen in order to have the outputs, and also the outcomes. It also includes the assumption and external influences that would affect the integration of, or could possibly affect the integration of evidence-based practice and research. Some of the assumptions, it is assumed that integration of research and evidence-based practice in the current LPN2 RN curriculum is possible. The program will have adequate resources and support to implement the proposed curriculum revision. Research and evidence-based integration will promote student interest and develop knowledge and skills required to understand the use of research findings in practice and improve student performance in classroom and clinical education. It is also assumed that nursing research and evidence-based practice has a formal and legitimate role in the curricula of diploma nursing program. The evidence reviewed was able to demonstrate a strong relationship between education and research. Nursing education programs have the opportunity to provide the skills to either read or understand scientific articles, which in turn would provide the necessary skills in practicing evidence based nursing. Nurses empowered with knowledge and skills are more likely to use evidence as a guide in making decisions related to practice issue. This project is a quality improvement endeavor for the existing nursing education program. This quality improvement will assist in meeting the mandate of practicing in the evidence-based perspective. The projected implementation on date for the first cohort into revised curriculum is in fall 2017. The anticipated duration to develop the program is approximately 10 months. A complete integration of evidence-based practice and research into existing curriculum will be the product that will be presented to the University of Cincinnati faculty. Since there is no change in the program's conceptual framework, there will be no requirements for obtaining approval from the Ohio Board of Nursing. The only reporting required would be to include in the annual report submitted to Ohio Board of Nursing, which can be completed after the initial implementation. As the nursing program progresses from quarter to quarter, concepts of research and evidence-based practice will be incorporated into classroom, laboratory, and clinical activities by sharing research-based, peer-reviewed articles and by showing various parts of the research process. The student will be expected to complete outside projects and required to participate in an online discussions. The program will require 6 hours of online learning and 2 hours of laboratory learning each week. The current total for clinical education is 12 hours a week. Each clinical group will be assigned a specific content module on which to focus their efforts under the supervision of their assigned clinical faculty. Program evaluation will consist of information gathered from students, faculty, and postgraduate data. The effectiveness of the integrated evidence-based practice and research contents will be evaluated each week at the completion of each assignment. Program feedback will be encouraged during faculty weekly meeting with formal written evaluation completed quarterly. The weekly feedback should provide ample of time to evaluate and make changes based on clinical, laboratory, and classroom learning needs.